Now, the Inter-Ministerial Committee on COVID-19 will be briefing the media at 6 p.m. tonight in Limpopo. A venue to be used as a quarantine site for the repatriated South Africans from China is expected to be announced at the briefing. South Africa's coronavirus cases have now risen to 17. The Health Department has confirmed that the Free State and Mpumalanga now have one case each. South Africa is expecting its citizens to return to the country after the Department of Defense and Health embarked on a mission to evacuate its citizens in Wuhan in China. And this, of course, is the epicenter of the virus. Countries are working hard to strengthen their plans with the aim of ensuring that they manage the spread of the virus. To date, the new cases involve one male in KwaZulu-Natal who lives in Turkey but was visiting his family in South Africa. Another case in Mpumalanga is that of a 27-year-old female who had traveled to the United States of America. In Gauteng, a 43-year-old male who had traveled to New York via Dubai returned to South Africa. And in the Free State, a 32-year-old male got into contact with a Chinese businessman. This is the first case of a local transmission, as all cases of patients so far had traveled abroad. At the moment, the Health Department says that all patients are in self-quarantine and are only displaying mild symptoms. Now, with over 118,000 cases of coronavirus in 110 countries, it's quite clear that this has now become a global situation of pandemic proportions, as the WHO has announced in the last 24 hours. Well, we now have in Pretoria our studio resident coordinator for the UN in South Africa, Ms. Nardos Bekele-Thomas. Thanks so much indeed for joining us, and welcome to the program. I guess now that we are getting to grips with just how global this pandemic has become and the spread of this virus, more and more nations and countries are going to have to work together.
Certainly. I mean, the fact that this pandemic is just a call for action, but a call for collective action, and it's a call also for responsibility and for solidarity. So nations should come together, but citizens of the world should come together. And in this, the media has, of course, a major role to play. And we call on the media for solidarity in terms of raising awareness and making sure that citizens understand their responsibilities.
All right, let's start with what nations can do together, because we're starting to see more and more countries closing their borders and stopping movement into the countries, almost creating this lager mentality. Is this helping or not helping?
Well, I think, as WHO, there is no restrictions. It doesn't go for restrictions, be it trade restrictions or closing the airports. But still, it depends on the country's risk assessment. The countries, each nation has a responsibility to assess the risk vis-à-vis its capacity and take a responsible action.
How has the UN been able to work on the continent in mobilizing countries to work together?
Well, WHO has been really very effective from headquarters level. Also, the Secretary General has been sending messages to all nations. This is a global phenomena. This is a global challenge, and the nations have to work together. And we are supporting nations in really delivering the results of their plans in the response to this pandemic. And here we would like to pledge our support to South African government and South African people that we are ready to lend our support, as it is our mandate, in helping the country overcome this monumental challenge.
You talked about citizens working together a short while ago. How can citizens work together in this instance? Most people are starting to panic, even if they're not showing it outwardly. I think fear is starting to grow a little bit.
Actually, I think, the media should help us in informing citizens that panic, fear, stigma, they are actually dangerous, more dangerous than the pandemic itself. Individuals have the responsibility in terms of making sure that there is a detection. They look at themselves. Do they have the fever? Do they have, the symptoms that they require? If they do, they have to report to the medical centers and get tested. Once they are tested, isolation would be very important because they are not supposed to go out and be the carrier of the virus. Therefore, I think testing, detecting, case monitoring, and also treatment are very critical and very important. So citizens should really understand their responsibility vis-a-vis their own health, also, but also vis-a-vis the health of the others surrounding them.
And I would imagine also we need to guard against profiling and discrimination, perhaps if we come across Chinese nationals or people coming from Europe and treating them differently.
Certainly, I think stigma is one of the most dangerous thing, because if there is stigma, then people hide and they don't go. They're afraid of going to the hospitals. They're afraid of exposing their problems. So stigma is not really recommended, and we should really condemn stigma. It's also really a human rights affair. I mean, we cannot deprive people that are infected from their human rights, from their dignity, and they shouldn't be labeled as if, this is something that they have inflicted on themselves. So we have to fight stigma, all of us together as a whole, society as a whole.
All right. I know that you've worked in a number of countries across the continent. Are you happy that Africa as a continent is more than capable of managing this pandemic?
We are actually very lucky that the continent is affected, but we depend on each country's capacity, and we hope that countries, while this pandemic is not reaching them, will have the time to build their capacity to be able to prevent and also to mitigate this virus and the pandemic.
All right. And then again, you spoke about the role the media can play. Perhaps one final word about the kind of reporting you'd like to see from the media.
I would like to see more of raising awareness in terms of what do you do, washing hands, minimizing socializing, and all these things should be part and parcel of the program of the radio, the TV, but everywhere we go, we should have reminders so that people will take the necessary caution. Because this is something that we need to do. Unless we do it, it's going to be spreading like wildfire. So, we have to have this awareness raising and sensitization programs in all its forms, in songs, in ways of pamphlets, distributing pamphlets, but also in having on billboards, like what we did a little bit at the beginning of the HIV endemic. So we have to really activate or reactivate all the means of communication towards educating, informing, and communicating with all people without any exception.
All right. That's where we'll leave it. Thank you very much indeed, Ms. Nardos Bekele-Thomas, who's the resident coordinator for the United Nations in South Africa.